Edmonton, Trista Claffey always thought kids would be a part of her future, eventually. But she's just discovered she has less than 6 weeks to raise the money to make it happen. The 26-year-old is racing to come up with about $20,000 to go through in vitro fertilization to freeze embryos before she has surgery to remove a large mess on her ovary. The procedure will leave her infertile and, she says, possibly affect the use of her legs because of nerve involvement. Claffey and her fiancé, Brad Conklin, plan to eventually have a biological child using their frozen embryos, with the help of a surrogate. If the couple lived in Ontario, one full cycle of IVF treatment would be covered by public health care, but Alberta offers no such thing. Claffey has neurofibromatosis, NF type 1, a genetic disorder that causes non-cancerous tumors to develop throughout her body. Article continued below. For most of her life the disease did not affect her in a dramatic way, but 2 years ago one of the tumors started giving Claffey severe abdominal pain. It was so bad she started taking oxycodone, an opioid, increasing the dosage every few months as her body adapted. In June, she finally decided she couldn't continue anymore and told her doctor she was ready for the surgery. Read more. Women should be told about their biological clock, says new guideline. Fertility funding fostered a diverse group of parents. Alberta parents call for better access to special needs services. She said she realized losing her ability to walk was something she couldn't control, but motherhood was. Article continued below. My sister and I always knew we would have a little bit of complications with kids because we both have NF. But I never thought it would be all of a sudden this huge urgency that I would have to do it now, she said. Claffey has already paid a $2,000 deposit to hold her spot at Pacific Center for Reproductive Medicine, the clinic handling her care. Over the next few weeks, she needs to take hormone injections, which cost between $2,000 to $4,000, to help her create more eggs. Those eggs will then be extracted and fertilized using IVF. One IVF cycle costs $7,000. That also includes embryo transfer for the surrogate down the road. Resulting embryos will then be tested for the NF gene, which means half of them will have to be discarded and the remaining healthy embryos will then be frozen. The testing, called pre-implantation genetic diagnosis (PGD), will take place in the U.S. lab and add $10,500, plus some additional lab and biopsy fees, to the bill, bringing the total cost to about $20,000. Claffey and Conklin have been trying hard to raise the funds. They started a GoFundMe in June. But a month later, after it didn't go very far, they decided to ask people they knew for bottles for a drive. I didn't want to ask people for money because it's really embarrassing. So I privately messaged a bunch of people and I was like, hey, if you don't mind, we are collecting bottles for IVF, she said. Claffey's sister and best friend have since joined them to organize bottle drives and an auction of home decor items and gift cards for restaurants. Even her niece, Dakota Martin, helped by holding a lemonade stand in Collingwood Splash Park last week. I think it's important for her because she really wants to have a kid, the 9-year-old said in between handing cups of strawberry lemonade to kids in the park. Trista Claffey left, and her fiancé Brad Conklin spent time with their cat, Charlie, in Edmonton, Alta, on Tuesday, August 14, 2018. Claffey has a genetic disorder which has resulted in a mass forming on her ovaries. She is getting the mass surgically removed, but that brings the risk of her not being able to have children. Cody McLaughlin, Star Metro Edmonton, Conklin said he was surprised to learn that IVF treatments were not covered by public health care in Alberta. I'm figuring out trying to write letters to the health minister, Sarah Hoffman, or Premier Rachel Notley or someone, because it's something that should be covered, he said. Ontario covers one cycle of IVF for anyone under the age of 43, as well as sperm or egg freezing for people who are expected to lose their fertility for a medical reason. Quebec did cover IVF until November 2015, after which the province axed funding for the procedure, except in the case of cancer patients needing egg or embryo freezing to preserve their fertility. New Brunswick offers a fund and Manitoba offers tax credits for the treatments. But both Alberta and British Columbia do not offer any coverage in their health plans for IVF. Erin Menn, press secretary for the Alberta Ministry of Health, said this may change. Our government knows that infertility issues can be very challenging for those wishing to start or expand their families. We want to be there for these families during such a difficult time, and will continue to protect insured fertility services such as testing and analysis, which improve fertility, he wrote in an email. While Alberta does not currently provide coverage for IVF treatments, this is something our government may consider as the economy recovers. Doctors have scheduled Claffey's surgery for the end of September, which means she needs to get the IVF treatment in the next few weeks. In the meantime, she continues to suffer. She said she spent a lot of her time in the bath, as that helps with the pain. This version of me isn't who I normally am. Normally, I'm very bubbly and happy and I want to go and do a lot, but now I would rather sit in a tub, she said. Kashmala Fida is an Edmonton-based reporter covering City Hall and diversity. Follow her on Twitter, @KashFida.